From today, I am starting a series of videos from the first month of pregnancy to the 9th month. First month of pregnancy. First month means you have just missed your period, and your pregnancy test has come positive. Now, when does a pregnancy test come positive? There are many patients who feel that I had sexual activity 2-3 days before I feel like I am pregnant, so should I do a pregnancy test? Or there are many people who say that I do not want pregnancy. I did not take the pill. What should I do now, or how will I know on the day of taking the pill that the pill has worked? I do not want a child. When should I do a pregnancy test? So for that, let me tell you that normally, pregnancy test should be done only when you miss your period. Because let's assume that if you have a 28-day cycle, you ovulate on day 14 in the mid-cycle, then 5 to 6 days after that the baby enters the uterus. That means almost 3 weeks of your pregnancy have passed. So in the next 1 week, if you test before missing your period, then in some cases there are 10% chances that the test may come out positive. But generally it comes out positive only after the period is missed. So you will have to wait for the missed period. When the period is missed, almost 1 month has passed. For example, your period came on the 1st of February, so by the 1st of March your child is already 1 month old. Many people get confused that we had intercourse about 10 days ago or 15 days ago. How did the child become 1 month old? When you go for sonography, it is already 1.5 months old. You say that 1.5 months have not passed. Because the period is counted from LMP, i.e., last menstrual period. Okay. Our science is such that she tells us how to find out the gestation of the baby, how to find out the gestational periods in sonography. All this works through LMP. 4 weeks to 5 weeks old baby's heart starts beating, and if we tell in sonography, then in a 6 to 7 weeks old baby, i.e. 1.5 month old baby, we can see the heartbeat too. It is fine in sonography. What problems do you face now? An embryo has come inside you, i.e. inside your uterus, i.e. you have become 2 in 1. All the blood supply of your body is going towards your uterus. Due to the blood supply going towards the uterus, you feel a slight heaviness downwards. A slight heaviness is there because your uterus is growing. Your uterus is growing. Uterus is normally 7 to 8 centimeters and is right inside the bone, just above the vagina, so you start having vaginal pains, your vagina pain. A different kind of heaviness in your vagina, slight stretching downwards while getting up or sitting down, all these problems. Some people also get a little itching because the blood supply there increases so much that you start itching there. Now the rest of the symptoms come. In the rest of the symptoms, you may feel a little nausea, but it does not come so soon. Nausea happens when you are already 6 weeks old, i.e. 2.5 months, because the reason for nausea is your high hormones. There are 3 types of hormones which bring changes in your body. The first one is HCG hormones, which causes vomiting, which comes out of your womb from the placenta and supports the child. When there is a fear of abortion of the child, then this injection is given to you by your doctor. The second hormone is progesterone hormones, which completely it maintains the pregnancy and does not allow the preterm birth of the child. This hormone keeps the uterus completely safe and does not allow any pain inside it. It does not allow its muscles to contract at all, and this is also a very important hormone, and it also causes vomiting to some extent. It brings the sensation of vomiting. And the third hormone is estrogen hormones. Due to these 3 hormones, pregnancy goes perfectly. And in the last 9 months, when there is a balance in these hormones, then some other hormones or prostaglands come inside you and cause pain. So, first of all, nausea starts a little late. First of all, you feel a strange sensation. There is a heaviness in the lower part of the body. There is a little heaviness in your vagina. It is very common to feel the urge to urinate frequently. Because the uterus stays inside the bone for 12 weeks, that is, for 3 months. It is growing inside the bone, and just ahead of it is the bladder, that is, the urine bag. As the size of the uterus increases, your urine bag will be pressed. You will urinate every 10 to 15 minutes and a little urine will come out. The reason is that it takes 2 to 3 hours for the kidney to make urine. It takes hours, but you will feel the need to urinate again and again, so you will go to urinate again and again. For this, first of all, you must get your urine infection checked because the same symptoms appear in urine infection too. For this, first of all, you must get your urine infection checked because these symptoms are also seen in urine infection. If there is no infection, then it is absolutely normal. You feel the urge to urinate again and again without any burning sensation. A little urine comes out. Along with all these things, you also feel very tired, and most of the tiredness is felt by those ladies who are pregnant for the first time. They feel more tired because an embryo has come in their body for the first time and the tissue genetic material inside the sperm of the husband's partner has come inside them for the first time. So they feel tired all day long, feeling lethargic, sleepy, sometimes getting half asleep while talking. All this happens due to hormonal changes. This is very normal. Now, why do you feel nauseous? Never eat a full meal when you are feeling nauseous. Or you feel that I am going to vomit, then you should not stay hungry, but you should not eat to your fill. Keep your stomach half full for food. If you are feeling very hungry, then eat 1 roti and get up. It will be a little difficult. The food will settle down a little. Eat again. Eat by dividing your food into at least 5 to 6 times a day. Food should contain everything: protein, carbohydrates, fat, curd, everything. Our Indian diet is very good. Everything is included in it in all quantities. Eat less spicy food. Eating spicy food will make you feel nauseous, but you can tolerate it for now. As the child grows in the 6th month, 7th month, your food pipe will be pressed, your stomach will be pressed, so much gas will be produced that you will have regurgitation. That is, the acid that is being produced in the stomach will start coming up from there and it will be very difficult for you. So keep yourself healthy from the very beginning and take a healthy diet. Get proper sleep. Do not stress yourself too much. If you work and you are facing difficulty in managing both things, then take maternity leave for the first 3 months. Read good books, stay happy, stay with positive people. A little bit of exercise. If you keep yourself active a little bit, it will be better. People who sleep all day have more constipation and gastritis, so don't think of pregnancy as a disease. In pregnancy, you are getting 2 in 1, a new life is coming inside you. You have to give proper blood supply to the new life and give it proper nutrition. The better you eat, the better you think, and the more you rest, the better it will be for you. But everything should be balanced, not that while resting you keep sleeping, not that you have stopped working completely. There are many women who lie down and sleep all day. If you remain lethargic all day, then the child will also be born lethargic. You have to take care of yourself, what to eat, at what time, what not to eat. So this is all that happens in the 1st month. The child is formed inside the child. Life has come, because his heart and lungs have started forming. I will tell you what happens in the 2nd month. You must subscribe to the channel. We will continue this series.